So my name's Jo Simons. I'm Exec Manager Strategy and Partnerships at Health Workforce Queensland. Well, HWQ has been around for over 25 years and we're Queensland's only charity addressing primary care workforce gaps in Queensland. We're primarily federally funded and we work to attract and support and retain GPs, allied health and nurses in rural and remote Queensland and for our Aboriginal and Torres Strait Islander communities.
I'm Daniel Leroyd. I'm the Chief Financial Officer and Chief Technology Officer for Health Workforce Queensland. Health Workforce Queensland as a rural workforce agency has for a long time had a lot of data, but that data had a use case for specific use cases. I'm compelled to provide deeper, richer, predictive modelling. And at that point, we knew we needed to scale our technology. We weren't placed to best utilise the technology and the data that we had to give real-time insights in how we could make a difference or display that impact in regional and rural and remote communities.
Yeah, so one of our jobs that we do every year is a health workforce needs assessment. We're looking at trying to identify the communities in highest need. Poor access to general practice, weren't able to get in to see doctors, closed practices. Some of those communities were really just falling through the cracks and we weren't able to identify them using the old methodology we had.
Health Workforce Queensland first come across Antares through a recommendation of Microsoft. That gave us some comfort that they could support our business. Then after being introduced to Antares, they took time to understand our business and our goals, and that gave us further comfort that we could work with them. We co-designed with Antares a series of workshops that helped to understand the requirements, to flesh them out. Then we designed a 2-year roadmap in phases. And the phases was important that as we embarked on this project, the business would gain some capability and use of the new technology as we went. Antares helped us move from manual to automated processes. Our data pipelines were automated through the establishment of new ingestion into the data lake. The data lake, importantly, gave us a central point of truth, a central point that we could then scale our future data use cases. Importantly, they also helped our staff to nurture and develop their capability to grow the platform. In turn, we gained efficiencies with our data scientists, our data analytics team, that they could spend more time telling those stories rather than the data processes.
So having our new prioritisation process dashboard has been really valuable for trying to show impact of what we're doing. So for example, we might see there's a community that has got a 4-week wait time, for example, to see a doctor. And then so we work with the recruitment team, our own internal recruitment team. They'll work with that practice to see if they can get doctors to go work at the general practice. And then we can monitor the wait time of that practice, and maybe the 4-week wait time goes down to a 1-week wait time, for example. We can see that, we can see it in real time.
Before we relied on manual processes, which delayed that insights to the company. That has improved now with real-time dashboards that enable a business to save time in its processes.
We knew that if we partnered with Antares, that we could develop a solution that was actually going to produce a better methodology and a better way of producing this ranking system of workforce need for us. What it turned out to be in the end was much greater than that. So we have not one page of a dashboard where the priority communities are identified and shown in a beautiful heat map, but we also have another 3 pages which you can drill down into the demographics, the profile of the community, what services are there, what facilities are there, all sorts of information about community from a community level, and also what services that we provide and how we help on the ground in those communities as well.
We believed we could tell better stories with our data. We believed we could show our impact to our funders, our stakeholders, to tell that better narrative of what is required in Queensland. We wished to utilise that data in a way that could be leveraged, that was more scalable. We had a lot of disparate data sources that we needed to join together that would place the business in a better position for the future, to run more predictive modelling, to be more proactive, to spend more time on the narrative, not just processing the data.
So now I feel like it's more, we can use evidence. I can use it in meetings, I can use it for advocacy, I can use it to develop up Workforce Solutions. Our teams can work with practices where it's most needed. So I feel like it's enabled the work that we do and made it more evidence-based.